Utah on the brink of a controversial decision: to fluoridate or not to fluoridate. Utah stands at a pivotal moment, poised to become the first state in the nation to completely outlaw the addition of fluoride to its public water systems. The fate of this unprecedented move rests solely on the desk of Republican Governor Spencer Cox, who holds the power to either sign or veto House Bill 81, HB 81. This bill, recently approved by the state legislature, would effectively ban fluoride across Utah starting May 7th, a decision that has sparked intense debate and divided public opinion. The passage of HB 81, championed by Republican Representative Stephanie Grishas, has been celebrated by proponents who cite concerns over potential health risks associated with fluoridation, echoing sentiments championed by prominent figures like Robert F. Kennedy Jr. Grishas, in a social media post announcing the bill's passage, expressed her gratitude for the support received and notably included the hashtag MAHA, an acronym for Make America Healthy Again, a slogan closely associated with Kennedy Jr. and his vocal opposition to water fluoridation. This connection to Kennedy Jr.'s campaign rhetoric, filled with widely debunked claims, cannot be ignored and adds a layer of complexity to the debate. Kennedy Jr.'s fervent anti-fluoridation stance, heavily promoted during his election campaigns, painted a picture of fluoridated water as a public health menace, a narrative that resonates with a segment of the population despite overwhelming scientific consensus to the contrary. This carefully cultivated narrative, however, stands in stark contrast to the decades of scientific research supporting the efficacy and safety of fluoridated water. The Centers for Disease Control and Prevention, CDC, unequivocally supports the benefits of community water fluoridation, citing it as one of the 10 greatest public health achievements of the 20th century. Decades of research consistently demonstrate that optimally fluoridated water significantly reduces cavities in both children and adults, a reduction estimated at approximately 25%. This preventative measure works by strengthening the enamel of teeth through the incorporation of fluoride, a mineral naturally occurring in soil, water, and many rocks. While nearly all water sources contain some level of naturally occurring fluoride, the concentration is often insufficient to provide adequate cavity protection. This is why many communities have historically opted to supplement their water supplies with controlled amounts of fluoride. By 2012, nearly 70% of the U.S. population benefited from access to optimally fluoridated water, a testament to its widespread acceptance and documented success in improving oral health. This preventative measure is not federally mandated, but rather a locally implemented initiative chosen by communities prioritizing the dental well-being of their citizens. The significant reduction in cavities attributable to fluoridated water translates to substantial savings in dental care costs, improved overall public health, and a reduced burden on the healthcare system. The implications of HB 81 extend far beyond Utah's borders. If Governor Cox signs this bill into law, Utah will serve as a precedent, potentially emboldening similar anti-fluoridation movements in other states and potentially jeopardizing decades of proven public health improvements. The decision, therefore, carries significant weight, impacting not only Utah's residents, but potentially setting a concerning trend nationwide. The scientific community overwhelmingly supports the continued fluoridation of drinking water. Numerous peer-reviewed studies, conducted over several decades and involving millions of participants, have consistently demonstrated the safety and effectiveness of water fluoridation in preventing dental caries. The benefits are clear: reduced dental decay, improved oral health, and significant cost savings in dental care. The potential risks associated with fluoridation, often cited by opponents, have been thoroughly investigated and deemed insignificant compared to the overwhelming benefits. Governor Cox's decision carries immense responsibility. He must carefully weigh the scientific evidence, the potential public health consequences, and the long-term implications of his choice. Will he prioritize the established scientific consensus and the significant benefits of water fluoridation, or will he succumb to the pressure of unsubstantiated claims and potentially reverse decades of proven public health progress? The nation watches with bated breath. The decision to sign or veto HB 81 will not only affect the health of Utah's population, but will also likely serve as a powerful precedent, influencing similar debates across the country. The future of water fluoridation in the United States and the oral health of millions hangs in the balance. The governor's decision will undoubtedly resonate far beyond Utah's borders, shaping the future of public health policy for years to come. The potential ramifications of this decision demand careful consideration and a commitment to evidence-based policymaking.